During this video segment, we're going to discuss the overview of hair transplant surgery. We'll do the overview, but eventually we'll get into the operating room and view some sophisticated equipment that is necessary these days to perform a hair transplant that's truly state-of-the-art. Now, assuming at this point you're a candidate for hair transplant surgery, and that's important because, of course, you would have reviewed medication therapy and other issues that has to be resolved, discussed, and understood to get to this point where now you're considering a surgical procedure. Hair transplant surgery is a major decision a patient needs to make. It's a very fairly expensive one. It usually takes more than one procedure, and that's important to know. If you need one procedure, I would tell you need one, but if you need 4 procedures, you might need 4 procedures. And that has to be discussed up front because patients have certain expectations, and those expectations need to be extracted out from you so I could translate that into numbers of grafts, which then translates into numbers of surgeries. So that all has to be planned out. But we're going to basically go over the techniques that are involved in our day and time. There's 2 basic techniques involved in hair restoration surgery. Number 1 is called a strip method, and the other is called follicular unit extraction. Okay, I'm going to talk about the strip method first. The strip method is whereby the doctor takes a strip of skin from the back of the head. This is the donor area. So they take a strip out, and then they lay it down on the table, and they basically chop it up, literally, into 1,000 little grafts and so forth, or 2,000, depending on how much they're going to take out. And then back here they suture it closed, so it's tightened up, and the result is usually a thin or relatively thin scar in the back. And then you have these grafts that now are dissected and which now are placed in either the frontal, the vertex, or the crown area. Now, the strip method is an acceptable method. It's not, in my point of view, the state-of-the-art method these days because it's unnecessary to have that linear scar that remains back here. Keep in mind that with that technique, which most doctors utilize, and they're used to using it because they have a staff, it's a relatively it's much easier, I should say, than the technique I'm going to discuss next, which is called the Lexis procedure. But the strip method is just a routine now doctors are involved with, and it's somewhat difficult to change when you're in a routine. You have a certain method, and if something new comes along and it's much more difficult, it's difficult sometimes for a doctor to shift into a different type of technique. Now, my personal opinion is that he ought to do that if it's best for the patient. So we need to adjust our thinking more towards what's more beneficial, obviously. And in my point of view, the strip procedure is inferior to the follicular unit extraction technique. Okay? So again, a strip technique is again taking the strip out of the back where you're left with a line scar in the back. I'm sure you probably know about that. Most patients do when they do research in hair restoration. Now, let's move on to really the sophisticated procedure that I think is far superior to the strip method, and that is what I call the Lexis procedure. The Lexis procedure, which bears my name, it's called the Loria excisional unidirectional stereoscopic procedure. And in essence, what it is using stereoscopic magnification to extract the hairs out of the back individually with accuracy, because you have the visibility of a stereoscope, and it truly is minute accuracy, which is needed because you have to parallel that hair shaft with a very tiny cutting instrument to take out that graft appropriately without damaging that graft. So the follicular unit extraction technique that I developed is a stereoscopic method, and I again termed it the Lexis procedure. Now that is not common. Microscopes are not used, I should say, not common in the United States, and they ought to be used because the hair follicles do exit at a certain angle, and really to have that visualized is very important. So without microscopic guidance, stereoscopic specifically, the chances of transecting a follicle while taking it out with a microscopic cutting instrument increases. So the risk of damage goes up. So getting a little more detail, understand that again, we talked about a strip. The follicular unit extraction actually is taking out each individual follicle. Okay, and we're going to demonstrate this actually with photographs alongside the video with some text to give you a more visual on that. But we use a circular cutting tool that's basically under 1 millimeter in diameter, and it cuts into the scalp very superficially, and we actually take the graft out individually. So let's say, for example, we were doing 1,000 grafts. We would do 1,000 little punctures in the back of the area here. We would shave a zone of hair and extract those hair follicles, and that would heal beautifully, like nothing ever happened to you. So the benefit is, number one, the linear scar will not be there. Okay, it'll heal superiorly, obviously, to a large cut that a strip causes. Okay. But here's where the challenge lies. It's within the doctor's mind, really, because he has to now undertake a much more difficult procedure. And again, I feel that that is something doctors ought to do automatically. But again, there's nothing wrong with the strip. I just want you to know that a follicular unit extraction method, or called the FUE method, is superior to a strip. And again, stereoscopic guidance is superior to, for example, let's say I've taken out these magnifying glasses here. See, these magnifying glasses are maybe 3 or 4 times magnification. That is not adequate, truly, to use for follicular unit extraction. Stereoscopic guidance is essential in my point of view, and that's what I use. Now, this particular technique works extremely well. Visibility, if you have that with a stereoscope, you can actually extract with accuracy. You don't need to shave the whole back of the head. You could just shave a thin linear strip and actually take out almost every other follicle or every third follicle because the visibility is so good and the accuracy is there, and that's important. Okay. Again, the Lexis procedure will allow for accuracy, near invisible scarring in the back, and then of course when we pull those grafts out, they're basically placed in the same way with little microscopic incisions and so forth. So that the other aspect of placing the grafts in the recipient sites, which would be here, here, or the crown area, does not change. We usually use very small cutting instruments to make little tiny cuts here to place those grafts in. With the Lexis procedure, the grafts are already made immediately. So when I cut in using stereoscopic guidance, you have now a graft that's perfectly cut already that now can be placed into the front of the scalp. Now the other method with the strip now has to be cut down. Okay, so there's a lot of processing involved there. Okay. Now, with a stereoscopic guided technique with follicular unit extraction, you have a graft that's perfectly cut right away by the physician, you see. So, as, again, an overview, understand that the strip method is acceptable if you're willing to accept a linear scar in the back, and no one could judge whether that's going to be a thin scar or a thick scar. Everyone heals differently. And if you have to have multiple procedures, you might have multiple scars. A lot of doctors don't take out that scar every time they go in again, so to speak. For example, if you did a strip, you have a scar there. Then if you went in again to do another procedure, technically you should cut the hair out and the scar at the same time to leave you with one scar all the time. But a lot of doctors don't do that. They'll take a strip here, then next time here, then over here, and then you have 3 scars. And then it's just a mess. It winds up being a mess in the back of the head. So again, the Alexis procedure, which is a stereoscopically guided procedure, is, I believe, far superior to that method because of the scarring and healing in the back and so forth. We're going to actually go into more detail about that Alexis procedure, and I caution, I do show some photographic results from this step by step, so it can be understood clearly by the patient. Okay, so that is an overview, a brief overview of a hair transplant surgery and regarding the two major techniques that are available. And just one more note, we do have an automated process, fully automated process, in which we could take out the follicular units. There are semi-automated processes and truly manual processes. The technique I use is in the middle. It's a semi-automatic process. There must be caution involved because of the fact that the fully automated process, the tissue is in touch with a lot of tubes and filters and all that kind of stuff that needs to be cleaned and sterilized. The technique that I use is when I take that graft out, I specifically put it in a chilled dish of saline or lactated ringers, a special solution, and it doesn't go through tubing and machines and all that. So I use the middle approach where it's semi-automated, where I use an instrument to actually cut in superficially to take the graft, but then I place it into a solution, in a chilled solution. Then you have the other side where you have a manual instrument cutting one at a time, which is, I think, is okay to do. I feel that there's the speed element is not there. If it's not stereoscopically done, again, you're losing the advantage of visibility, and that's not favorable in any type of surgical procedure, right? Visibility is very important. We need to see what we're doing. So that's, again, a brief overview of hair transplant surgery and the techniques available. We will be adding text and photos and so forth on a daily, almost not a daily basis, but we'll be adding information as it comes, updating the website and so forth. So be patient and just look out for that information.